have a very unique program here. I don't believe that many hospitals in Brooklyn have it. Our team, our transitions team, follow you from the first day of admission all the way through to when you're discharged from the hospital, and then we stay with you while you're in the community. Actually, you're never discharged from transitions. Also, we focus on your personal needs, your cultural needs, while we're planning your care here in your discharge plan. We relate to your family, and we involve the family in your discharge plan. And also, yes, after you leave, we'll stay with you. We make sure you get your medications, we make sure you get your PMD appointment, and we make sure you understand how to take care of yourself. The ultimate goal is to actually prevent you from returning to the hospital in a sick fashion. The goal is to help you even get better than you were before. Actually, we have these HCAP scores, and they're published on the websites, our hospital compare site, and our scores for transitions is the highest in the metropolitan area. I attribute our success in the HCAP scores to our care managers, the specially trained group of individuals who follow the patient from the first day of admission, address their cultural needs, address their family needs, and stay with them from discharge into the community, calling them up, helping them get their PMD appointments, helping them coordinate their prescriptions, and assisting with their insurance coverage. Usually hospitals do a great job until discharge, but we're so familiar with the needs of the patient from their financial situations, their housing situations, and everything culturally about them. So we address those issues once they're discharged, including how to get optimized services in their home and outside of their home. We involve the doctors, the nurses, our social workers are highly skilled. Our RN case managers are highly skilled. These transitions in care coordinate with each one of the team members while the patient is in the hospital to find out about their vulnerabilities, their risks, and exactly what do we need to focus on. Is it diabetic teaching? Is it medication teaching? Is it both? Is it how to care for themselves? Do they need equipment at home? How to get them their equipment, how to get them their walkers, how to get their prescriptions delivered. And then we follow up to make sure, did you get your prescriptions delivered? Did your home care person come to your home? Did you get your walker? Did you get your cane? Did you get your right toilet seat, your shower chair? We make sure that all of this happens once they're left. So there's a great deal of care that is taken post-discharge with the patients that are here in Kingsbrook. The benefit to the community is a healthier access to care population. I find that in this area, our access to health care, it needs help, and we help them. We tell them where to go, when to go, and how to do it. And this makes them healthier. Our community wants to take care of themselves, but very oftentimes they don't know where to go and how to get it done once they're discharged. And we show them how to do this. Absolutely call me. I'm at 718-604-5249. With that said, I would like to introduce Ms. Herbert, who is our first care manager ever to work at Kingsbrook and helped generate and expand the program to now we have 4. And you can reach Ms. Herbert at her phone number as well, and she makes it available to all the patients the first day of admission. But please call me and we can fill you in on the rest of the program. One of the things we find is that in servicing our patients and servicing our population, there's an awful lot to do with the social determinants of health. And so one of the things we looked at was finances. And of course, we're all working, and we're finding how difficult it is to make budget and do various things, which is normal for the middle class now. However, there's a unique story. We found that we had a sickle cell patient who was unable to get her medication, and she always came in for noncompliance. And she had an attack and came in for noncompliance. So we went to the bedside and we did a fact finder with her and spoke to her, and she said, I can't afford the medications. So when we called up and after she was discharged, we had a home visit done. And the home visit determined, looking at all her bills, which she voluntarily showed us, that she was paying $700 a month for electricity for a small apartment. And what we found was there was a subcontractor going around offering people in Brooklyn a better rate for their electricity and saying, you pay us and we'll pay your electricity. So she got involved with this scheme and they kept raising her bill. So we got her out of the scheme. She brought her electric bill down to around a very low amount, about $100 a month, and was able to get her medication. Other things we find is that people don't understand their insurance. They don't understand what they're entitled to. They don't understand when a HMO refuses care that we can intervene and get that approved for them. So our care managers deal with the social determinants of health, whether it be financial, or some patients are supporting their families in their homes and have families living with them. And they don't want to lose their home because they're living with their granddaughter and their daughter lives with them. And we find ways to help them in the house and get the care in spite of that fact that they own a home. So there's an awful lot of social determinants of health that are emerging as a result of the deficits in our government's healthcare system at this time. So we help, and it's not only in Brooklyn, this is probably all over the country. And that's why we feel that Transitions in Care really should be a mandated program. But we are the first to strike a new pathway, and we're finding how necessary this is for our community. And not only our community, but to get the message out maybe to the entire country. Now it's extending into the working poor. So we have a whole class of middle-class people that are working 2 and 3 jobs and still have difficulty affording their medications and getting care that they need. And also, concomitantly, the pharmaceuticals have increased the price of medications. And so it's really a perfect storm right now for all of us. So Transitions in Care is even more important than it's ever been. It's an entire new care plan. The breadth and the scope is enormous, especially with new diagnosis, new diseases, and all of the things that are happening to even our young population today. So as new diseases emerge, we need to have that follow-up, so we have the expertise. And I am a nurse practitioner as well, so I can guide and help my staff clinically. And we can have clinical classes, which I'm competent to do. So it really lends itself to a huge success, and we're very grateful. I'm grateful for my team, who takes this very much to heart, and we're very dedicated. And I think that lends itself to my success.